I'm Elizabeth with Elizabeth's Healing Path, and now we're going to do my favorite, which is the fascia. Now, the myofascial release works with the fascia surrounding the muscle. And it doesn't just surround the outside of the muscle, it surrounds each and every fiber. Now, it also surrounds other things, such as organs, bones, nerves, things like that. And when it gets a restriction, which generally it can get from things like trauma, both emotional and physical, scar tissue, which we're going to have a video on that. Even things you'd be surprised with. I've worked with clients who are now in their 60s or 70s, and they never really treated the injuries they did when they were high school playing football and getting tackled, and it created a lot of trauma in the body that they wound up paying for later in life. One of the things I hear so often is, I could do anything and bounce back when I'm younger. Now I wake up on the wrong side of the bed. The bed didn't create the pain. It's an old injury that you probably triggered somehow. So, how do you know if it's fascia? As someone who specializes in fascia, I would say, are you ticklish? I can feel density with it. He's tightening now because he's ticklish. But I can feel like pressing into the body. I can feel tightness, right? Mm-hmm. So, as a client, I just kind of say, assume it's fascia. They knocked out the trigger point to the tender points is probably most likely fascia. Something to ask yourself, is it worse in the morning or at the end of the day? When it's the morning, my experience is it's fascia related because it kind of tightens up as we start moving. We start to warm up the body. The fascia is very liquid. By the way, strolling under the skin, so fascinating about fascia, but I'm a bit of a nerd. So I want to show you the techniques that are my most requested techniques for myofascial release. Now, I'm not going to show you how long I do them. Keep in mind, each one is held for about 5 minutes. So, let's see. What's requested number 1? I would say the cervical traction is number 1. So what I do is I go under the occipital ridge. You got to go look that one up. But there's a ridge here under the skull. First, you allow your fingertips to melt into the tissue. 1 minute, 2 minutes, 3 minutes. Just this is amazing in itself. And if you want to do this at home, they sell this cranial cradle, which does the traction, cervical traction, and it does a really good job with it. I've done that for myself. And then you can also use it for maybe any trigger points down the neck as well. So you got that going for you. So I, again, hold this. I think I'm going to stay in shot here. It's a big shot. We're going under, allowing the head to melt. They're going to want to help. Don't let them help. Tell them your head's not heavy. It's only 10 pounds. So again, I'm going to go faster. But I would then start tractioning just by slightly leaning back. I've had students say, how can you hold this for 5, 10, 15 minutes? If you tense up your shoulders, if you're going too hard, you get tired and worn out, and then you don't get the full effect. So be gentle on the client and on yourself. You get better results and be able to hold these poses for longer. So at least 5 minutes with this guy. Another one that's pretty popular is, again, on the occipital ridge, turning the head to the side, putting the head on top of the shoulder, and doing a stretch of the neck. I know you're looking at it going, that looks lovely. Now, if they're really tight, one thing you can do is, remember we were talking about tender points, you can first compress the shoulder up, kind of compress the neck down, and create shortening of all of the trapezius muscle, the upper traps, before then you go into this stretch. Again, 5 minutes. So that's number 1, I would say, most requested. Now, are leg pulls more requested or arm? I think the legs have it. So there's a couple different things that I do for the leg. Either way, you're going to grab. This client's wearing socks. That's okay, as long as you can get to some skin here. get to the skin, you're going to allow your hands to melt into the tissue. Don't jump into it. It's not like regular massage. You don't have to start doing things right away. Allow yourself to center. Sometimes I count my breaths to really encourage myself to allow the tissues to melt. And then you just lean back like you're water skiing. Don't tense your shoulders. Don't use your hands too much. It'll get a better result. So 5 minutes here. And while I'm doing this, keep in mind this is not treating the fascia down here. This is treating the fascia up the leg, the knee, the legs, the hip. Most clients feel it in their low back. If not, it's usually because the knees are tight and it kind of starts working on the knees before it can get up to that hip. So as I'm doing this, I can say, sometimes I like to do a little jostling, testing the body, see if one hip maybe is tighter than the other. After the 5 minutes, I usually pick one of two options. I either do a fist to the bottom of the foot to create, to stretch out the back of the leg even more. And this one, instead of leaning back like I'm skiing, I'm pushing in. I'm not like pushing this way, just leaning my body in. Work with your body. Don't be fighting the client's body. So this would be another 5 minutes. Grab the top of the foot without a sock, lean back again, another 5 minutes. That's 15 minutes. Ultimately, everything I'm showing you would take up a whole hour. So I don't do them all. I pick which one I want to do. Now that's a leg traction. If I want to do a leg pull, I would bring the client's leg and to see what they can go into full range of motion. So with this, we're going to the point of resistance, and then we're stopping. We're waiting at the barrier for everything to melt, for things to be ready in their time. This is totally the barrier. Now, I could push him farther, but that's not my goal. And while I'm doing this, I could also test to see if there's a trigger point by having him resist me and see if we can get a little bit farther. But he's tight right here. Now, ultimately, I want to bring the leg all the way to here-ish. I have some clients get, but I don't want to put that onto the client. I want to be like, oh, they have to get here. Just seeing what the body is ready for today. So I might take 5 minutes on this side, and then might even come up to see where we are here, grabbing the top of the foot, getting little plantar flexion. This one, he does have good range of motion. Hold there for 5 minutes, which can be tricky. Your arm can get a little bit tired. One more. You can leave it off. That's fine. One more is we're going to come across the body this way. Let me come on this side so my back's not to the camera. And we're at the barrier right here. But I have clients who can get here. I have clients that get down here. No expectations, just allowing the body to do what it wants. This takes me 15 minutes to do those 3 positions. And that's a leg pull. I may do both, I may not do both. I will say that sometimes if I only do one, then this leg gets jealous. Based off of what I actually found, this is actually the leg that needed the leg pull. But I use the traction to see, which one I want to do. So that is the leg. The arm pull works exactly the same way. Let your arm get heavy. Take the gravity out. Let it melt first for a minute before you start doing anything. Then you come out and up, and he's totally helping, which I would stop him if I was not doing a video, because it's fine, because we're not actually doing the technique. I have him come up, and then take a deep breath in. We go across. Oh, and the low back absolutely loves this. And then allowing the arm to go back down. So I would say those are my most requested. We're actually going to do one more, and I need you to turn over for it. Yeah, go ahead and turn over. Sorry.
Fine.
We're doing the glutes. It's not my most requested, however, I find that it's the most needed, especially in my clients who have piriformis issues. Like piriformis meaning sciatic nerve. So the first thing I do, this is me tripoding so I don't hurt my back while doing it. Think of it as in 3 sectors. So we have the gluteus medius minimus here. So I like to put my fist into those and do circles one way and then the other way. This is me. Not only does it feel good because this is a form of deep fiber friction if you compress into it and move a joint, but I'm also assessing the body. And then I'm going to put it right over the piriformis and gluteus maximus. Circles again, assess. And then I like to go over the lower glute maximus fibers. Usually it's not the lower guys, but I like to test them anyway. It's usually the piriformis, especially if they're having sciatic issues. Use the heel of the hand over it, a fist. I like the elbow. And you're going to put them into an external rotation. Yes, this is external rotation. You can also do internal rotation. And this is going to get held for 5 minutes. If they're tighter on their internal rotation, you can totally do this way and hold that for 5 minutes. Most of my clients I find are tighter here. So holding this for 5 minutes. And then the other technique that if you're my massage students, you use very, very often, it's called a cross hand release. By the way, that was also called, some people call that the pin and stretch, where you pin into the muscle and you do either a rotation or a stretch. That's called a pin and stretch as well. So a cross hand is you put your hands here and here. You see how I'm making an X with my hands, allowing your shoulders to melt, and then you're pushing this way and this way, but gently. Allow your shoulders to stay relaxed when you're doing it, and it's going to be about 5 to 10 minutes holding here. And just picking a spot. For example, we've been working a lot on this side of the back, so I'm testing it and going, hey, he's actually kind of tight on this side, and I would go over to the other side and do that. Okay, so pin and stretch. And if you want to go the more traditional route, there's many different forms of myofascial release. We have the J stroke. You're literally doing a J. And you can do that into a tight spot. Now, if you're a client, I totally train your family members to do this. This is amazing work. If it's just you, I highly suggest starting a yin yoga or a restorative yoga practice because they hold poses for 5 minutes. And in doing that, you are helping get down to the fascia layer and creating length within that and releasing tension, usually. You can also try some myofascial unwinding, which I have another video about that. And it's more of like a dance. I like to put on some drums and allowing my body to move or unwind the tension within it. Both those are great self-care videos. But that is myofascial release.